Welcome to Health Source of Puyallup, Washington. Today's topic, in back pain for good. Back pain for most people is a common part of their daily lives. They've suffered from chronic back pain symptoms for so long that they've learned to compensate for the loss of movement and flexibility, and tend to either ignore or medicate the pain. If this sounds like your life, there is a way out of this vicious cycle of pain. Back pain will affect nearly everyone at some point in his or her lives. Those who have physically demanding jobs and those who live very sedentary lives tend to suffer the most. But before you decide how to fix the problem, it's important to know what is causing the pain in the first place. Our backs are made up of 4 regions that contain more than 30 bones: the neck vertebrae, the upper back vertebrae, the lower back vertebrae, also known as the lumbar region, and the tailbone. While most individuals will tend to experience most of their pain in the lumbar area, there are cases where extensive injury has occurred in the upper back and neck region as well. Between these vertebrae are spongy structures called discs that are filled with fluid and help to absorb compaction between each vertebrae. The vertebrae and the discs work together to encapsulate the spinal cord. The spinal cord has nerve roots that reach between the spaces of the vertebrae and send messages throughout our bodies. The trouble occurs when one of these discs bulges or herniates out of its cavity. The fluid from the herniated disc can then brush up against any one of the nerves surrounding it, and that's when we cause pain. Bulging or herniated disc can happen for any number of reasons. Someone may have lifted something too heavy and put too much pressure on his or her back, causing the problem. An injury through work, sports, or vehicle may have been the culprit. Other times it can be as simple as being overweight that's causing your back problems. Whatever the case may be, you do have options besides surgery to eliminate this life-altering pain. A doctor of chiropractic may be your solution. Chiropractors have years of training under their belts and have been schooled extensively in the whys, wheres, and hows of the spine and its surrounding tissues, muscles, and ligaments. They treat all 4 types of back pain and will never do anything invasive or painful to relieve you from your back pain. Quite the contrary, chiropractors have some of the most gentle and effective techniques around, whether it's using their hands or using a computerized machine to pinpoint the injured area more efficiently. Most insurance companies now cover alternative care such as chiropractic, so that means little out-of-pocket expense for you. And chiropractors don't just treat the injured area and send you on your way. They will work with you through means of massage, exercises, and even progressive rehabilitation to both strengthen and condition your spinal muscles and tissues so you can reduce the likelihood of this problem recurring. To learn more about back pain and how chiropractic can work for you, find a Health Source Chiropractic and Progressive Rehabilitation Center near you. Their friendly staff is always ready to answer any questions or concerns you may have. For more information on topics like this, go to www.washingtonchiropractorsource.com/Puyallup.